So here we can see few mental health terminology, right? So mental illness refer to a wide range of mental health condition and also disorder that affect your mood or affect your thinking and behavior. Like example of mental illness include depression, anxiety disorder, schizophrenia, or eating disorder or addiction behavior. Let me talk one by one. First of all, we have to know what is organic disorder and what is functional disorder. So there are two primary characterizations of personality. One is the mental and other is the behaviors. So below are some of the key definition we will get for the terms we mentioned, the mental health terminology, right? So first of all, if I ask you what is mental health? Mental health, a state of successful performance of mental function and resulting in productive activities or fulfill relationship with other people. And it is the ability to adapt to change and to cope with adversities or coping with adverse environment. So who can adjust with any environment, so-called smartness, but we call the coping mechanism. So first of all here, let me tell what is the organic disorder. This presentation, we are going to focus in psychiatry or mental health nursing. So organic disorder, or we call organic mental disorder. Let me read it. An organic disorder is a form of decrease the mental function due to a medical or physical disease rather than a psychiatric illness. Example include dementia, means forgetfulness, and the result of encephalitis, means inflammation of meninges or meningitis. Also hypoxia, brain injury or chronic drug abuse or alcoholism. So organic mental disorder are disturbance that may be caused by any injuries or disease affecting the brain tissue, as well as by chemical or hormonal abnormalities. Example, like someone is exposed to the toxic materials or neurological impairment or any kind of abnormal change associated with aging can also cause organic disorder. So organic mental disorder, if I explain a little bit more, I want to tell you mental or emotional problem caused by brain pathology, like brain injuries or disease, drug damage, poison, and so on. Organic disorder may cause severe emotional disturbance or impaired the thinking, memory loss, we call dementia, or personality change or delirium. Also, psychotic symptom as well. So dementia, we wrote here because dementia is the most common organic problem and also a serious mental impairment in old age caused by the brain deterioration or degenerative change. What about the functional disorder? A functional disorder is a form of decrease the mental function with no known organic basis, but are believed to be the result of psychological factors such as emotional conflict or stress. Examples include antisocial behavior or phobias or personality disorder. Also, allow us to say hearing problem or perception, smell perception, taste perception, also feel perception. So functional, if I say functional neurological disorder, means functional neurological disorder is when there is a problem in the function of nervous system and is a term we use for symptom of even unknown origin. So next, here we said functional disorder in psychiatric and functional neurological disorder, the two terminology. And basically, functional neurological disorder, a newer and broad term that is include what some people call conversion disorder, right? And feature of nervous system or symptom that cannot be explained by a neurological disease or other medical condition, right? So now let me continue this one first.
There are two primary characterizations of personality, mental and behavioral disorders. An organic disorder is a form of decreased mental function due to conditions associated with brain disease and due to medical or physical diseases rather than psychiatric illnesses. Examples include dementia or Alzheimer's disease, the results of encephalitis, meningitis, hypoxia, brain injury, or chronic drug abuse and alcoholism, where the brain is affected. A functional disorder is a form of decreased mental function with no known organic basis, but they are believed to be a result of psychological factors such as emotional conflicts or stress. Examples include antisocial behavior, phobias, and personality disorders.
So in psychiatry, we will discuss about the different type of personality disorder. Like few of them we mentioned, antisocial, phobia, or personality disorders, like borderline personality disorder or narcissistic personality disorder, avoidance personality disorder, or dependence personality disorder, paranoid personality disorder, also obsessive compulsive disorder. We will discuss all of them one by one.
In either case, these disorders may cause significant distress, disability, or an impairment in areas of social functioning. Phobias are an extreme or irrational fear of or an aversion to something. We'll start with claustrophobia, which is the fear of small or restricted spaces. Studies show that 5 to 7% of the world's population suffer from claustrophobia. Next, we have aerophobia, the fear of flying. Again, 5 to 7% of the world's population suffers from aerophobia. Take a look at acrophobia, the fear of heights or falling. 10% of Americans suffer from acrophobia. Next, we'll look at mysophobia, otherwise known as germophobia, the fear of germs, which usually results in chronic hand washing. And finally, we have another phobia, glossophobia, the fear of public speaking. Now we'll look at personality disorder.
So if I say, what is phobia?
Now we'll look at personality disorder. Personality disorders, the fear.
So phobia means an extreme or irritational fear of or aversion to something, right? And phobia, extreme or irritational fear or a aversion to something. So here, few of the phobias talking about. Some people have a situational phobia, like claustrophobia, fear of small and restricted space. Like some people has a fear to use the elevator. Some people has a fear in MRI, magnetic resonance imaging. It is the diagnostic test. Use a small chamber. You have to put your body or head inside and the machine is rotated. So some people has a phobia on it because of small space, situational, we call claustrophobia. Some people has a phobia in aircraft, we call aerophobia. So fear of flying. So you want to go from New York to London, it is more than 80 hours journey. So a phobia can attack you, right? It's better to take the medication before to start a long journey, if you have it. Some people have a glossophobia even, right? Also, it's a acrophobia, means fear of height or falling. Some people has a phobia to the natural environment, right? Even water, we call hydrophobia, or the green trees, we call dendrophobia. Some people has a phobia to medical treatment, all right? So you are okay with any department, but you have a phobia when you go to your dentist, we call dentrophobia. Some people have a phobia when they see the blood, we call hemophobia. Like the COVID-19 outbreaks, pandemic right now, you're working in the hospital, there are no COVID patient, but still, when you come back to home, some phobia behind of you, right? It is called fear of pathogen, antigen, or microbes, biophobia or mysophobia. So even some people has a phobia to the animals, right?
Of public speaking. Now we'll look at personality disorder. Personality disorders are characterized by poorly adaptive personalities who demonstrate impaired social functioning. When we look at personality disorders, we can categorize them in basic terms. First of all, we have the antisocial type. This is when an individual has chronic antisocial behavior in which the rights of others are violated. Next, we have the narcissistic type. Narcissists have interpersonal problems which arise due to an inflated sense of self-worth. We have the masochistic type. A masochist is gratified by inflicting pain and suffering on oneself or others. We also have obsessive-compulsive disorders. Individuals with obsessive-compulsive disorders often have a preoccupation with extreme orderliness, perfection, and control.
So here, talking about the personality disorder types, the patient who have personality disorder, they may be associated with childhood trauma or substance use or also criminal behavior. They give the history like this. So the personality disorder is one type of mental illness. So let me tell something. The sum of the major type of mental illness are depression, anxiety, schizophrenia, bipolar mood disorder, and personality disorder. What we are going to little bit talk here. And also some people have a trauma or post-traumatic syndrome, or even some people has a eating disorder like anorexia nervosa. But most common mental illness are anxiety and depressive disorder, right? So here the table we can see antisocial, right? Antisocial type personality is called chronic antisocial behavior in which the right of others are violated. So they have a poor impulse control and they disregard for others. Also, unlawful action they do. And also they have the people who have antisocial behavior, they have chance of suicidal risks. Important. Another personality disorder is called narcissistic type. So this type of people have interpersonal problem arise due to an inflated sense of self-worth, right? And narcissistic, they have one character of grandiosity. They always think they is all in all. Also preoccupied with uh, the fantasy of power and success. The best example is a Hitler. Also explore to others to achieve the personal goal or others sensitive to criticism. Another personality is called obsessive compulsive personality disorder. So maybe they have an abnormal belief and they do something and feel good, reduce their anxiety. So repeated abnormal thinking come again and again. It is called obsession. And they do something to reduce the obsession or anxiety we call compulsiveness. So I said, I'm washing my hand because of the any kind of pathogen or bacteria or virus. You wash your hand one time, two times, three times, it is okay. But if you wash your hand more than 100 times in the same sitting, this is obsession. And you washing hand because to reduce your anxiety, you try to eradicate or remove the pathogen from your hand. So you washing your hand, we call compulsiveness, obsessive and compulsive. This type of mental disorder patient, they need high need for routine when you deal with them. Also limit, but do not interrupt the compulsiveness act. If you do this, then anxiety go up. The treatment of obsessive compulsive disorder, we try to stop their obsession. There's so many techniques we follow. Also, anti-anxiety agents, or we give them SSRI.
When we look at personality disorders, we have to continue several other categories. Pyromania is a deliberate fire setting which brings a sense of self-gratification. Next, we have pedophilia. The pedophile is an adult who is sexually attracted to and or involved with children. Kleptomania. The kleptomaniac has a chronic condition of stealing objects not needed for use or monetary value, but just to steal objects. We have some eating disorders. One is anorexia nervosa. An individual with anorexia nervosa has an eating disorder due to an extreme fear of gaining weight, and they typically will not eat at all. Another type of eating disorder is bulimia nervosa. This is binge eating, followed by self-induced vomiting and or the use of suppositories or enemas.
So here, NCLEX board sometimes or frequently asks the question about the eating disorder. So let me talk a little bit more about the eating disorder. Then we go the next level. So first of all, the eating disorder is the common symptoms of binge eating disorder include the eating a large amount of food rapidly, right? Or in secret and until uncomfortable full or despite not feeling hungry. So first of all, eating disorder is extreme emotional attitude towards the food. Example is bulimia nervosa or anorexia nervosa. So first of all, anorexia nervosa, this one, eating disorder due to extreme fear of gaining weight, right? So whereas the anorexia nervosa binge eating followed by self-induced vomiting. So they put their hand inside the mouth, throat, and then they vomit. So first of all, if I said anorexia nervosa, the anorexic people are not in normal weight. Their body weight is not normal, right? Also, they look like they starve themselves. In the anorexia nervosa, people avoid food and meal, and their bones become brittle, body temperature, heart rate, blood pressure drop, and may result to reduction in organ size and can lead to the heart problem. In case of anorexia nervosa, it is the psychological and they need psychological therapy or family therapy may be needed. Whereas the bulimia, they forcefully vomit, also eat a lot, but then purge or vomit it out. So during the eating, they forget everything. They eat too much, but after eating, they put the finger into the throat and they vomit. If not vomit, if not vomited out, then the person may exercise or do something for reduce the weight. Usually the patient who is bulimia, their body weight is normal in relation to their age and height, but anorexia nervosa, their weight is, not normal, I said. And bulimia patient causes dehydration or sore or inflamed throat, damage their teeth, irregular heart rhythm or heart failure is more common. Also, chemical imbalance in the body because of vomiting, right? As like as anorexia nervosa, they need behavioral therapy and psychological therapy may be needed. So again, I said this is two common disease of eating disorder. Okay.
Vomiting, and or the use of suppositories or enemas. Anxiety. All of us experience anxiety from time to time, and it can be helpful to sharpen our wits. Anxiety is classified as a fear of the unknown, a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Anxiety is categorized as well as a nervous disorder by excessive uneasiness and apprehension, typically associated with compulsive behavior and or panic attacks.
Okay. So anxiety is the most common, right? Anxiety disorder, excessive fearness, and even they have a fear to any kind of phobias. So anxiety basically mild, moderate, severe, and panic level. So who have a mild anxiety, it is associated with everyday life and can be motivating or behavior, right? Also, because of mild anxiety, sometimes we work more. But when anxiety is moderate or severe, it is impaired our abilities. So who have moderate or severe anxiety, they significantly reduction in their perceptual field or they difficult to focus on their specific work, learning problem, or problem solving cannot take place. hmm, but who have uh, severe anxiety, and they become aware of something called the sense. In case of panic level anxiety, the sense of impending doom is more common. What does it mean, sense of impending doom? It is a sensation or impression that something, tragic is about to occur. This is the abnormal sense. Also, the panic level anxiety, personality is disorganized. The person who have panic level anxiety, I say, personality is disorganized and cannot communicate or function effectively. Or panic level disorder, person loss of rational thoughts. They have a delusion or hallucination. Delusion means abnormal, I mean, abnormal thoughts, misperception, trust. And hallucination means mistrust with perception. Also, panic level anxiety, inability to concentrate, or when patient have it, the nursing intervention is very important. So what is our roles? We set limit on behavior. We make that set limit for them. Also give them direction activities. Anti-anxiolytic medication is very helpful, right? So when we're dealing with the patient in psychiatry unit as a RN, the nursing intervention is very important. First of all, safety is the most important priorities. We can provide the support for caregivers. Also, we refer to the community resources. We also attempt to have consistency of caregiver.
Typically associated with compulsive behavior and or panic attacks. Psychosis is a very broad term that covers many different symptoms and experiences. Common symptoms of psychoses include hallucinations, and it's important to differentiate between a hallucination and a delusion. A hallucination
So, first of all, they said psychosis is a broad term that discover many different symptoms and experiences. So, psychosis is a mental health problem that causes the people to perceive or interpret the thoughts differently from those around them. And this might involve hallucination or delusion. So, as I told you, common symptoms include here one is hallucination and one is delusion. Let me talk about the delusion first. Delusion means a false fixed belief, right? So a false personal belief based on incorrect perceptions about reality, which are inconsistent with culture or previous belief, and which are firmly sustained in spite of evidence or proof to the contrary. Easy way to say it is a false fixed belief, and what they believe it is not no relation with reality. Second keyword is hallucination. Hallucination is a sensory perception, but there are no stimulus. Another key word is called illusion. Illusion means misperception of stimulus. But hallucination means sensory perception, but there are no stimulus. If there are stimulus with misperception, we call illusion. Hallucination may be visual, maybe auditory, or maybe sensational. So you can see something others do not see. You can hear something, but I do not hear it, right? So like I'm using my computer and this is the cord connected to the electricity. Everybody can see this is the cord or charger, but I can see this is the snack. It's called visual hallucination. And sometimes I can hear something, I can get some direction, do this, do that, but you do not hear. It is auditory.
Nation is seeing, hearing, feeling, or tasting things that other people don't. Oh my gosh, look, there's rats everywhere. Yet there are no rats. Delusions are false personal beliefs based on incorrect perceptions about reality, which are inconsistent with culture and previous beliefs, and which are firmly sustained in spite of evidence or proof to the contrary. An example of delusion would be, they're out to get me. Everybody's staring at me. When in fact, nobody is out to get them. Individuals with psychoses often feel overwhelmed by sensory information. The lights seem too bright, the noises are too loud. This can trigger confusion, frustration, and agitation. Individuals with psychoses have difficulty filtering stimulation from the environment and separating it in their mind. Individuals with psychoses have difficulty at times doing very ordinary things. And psychosis often includes problems with memory, attention span, and putting thoughts together. Finally, individuals with psychoses have periodic difficulty with understanding and functioning in what most individuals perceive as reality. Just who experiences psychoses? Anyone can develop psychoses. Many people see or hear things that others don't, or have ideas that are very unusual. Psychoses is only a problem when it's causing you or somebody close to you significant distress or harm. Psychosis affects approximately 3 in 100 people and usually occurs for the first time between the ages of 15 and 30. Men often develop psychoses 5 to 10 years younger than women. It can be caused by a variety of medical illnesses, sleep deprivation, severe distress or trauma, drug reactions, a genetic predisposition in the family, and other factors.
So in the summary, I want to share something. The overview of mental health nursing. So mental illness, actually, it is an inability to cope with or manage the stress. They do not know how to deal with the stress, or any disorder that affects the mood or mental illness or behavior. The illness affect my mood, maybe mania, maybe depression, or it is all affect my behavior. Also incorporate cultural or ethical practice and belief when planning the care. So when we plan the care, it is important to consider the patient culture, their ethics, their race, right? And also their trust and belief. So also it is important when you deal with them, we have to follow the legal or ethical issues. The therapeutic communication with this mental health patient is very important, right? And also as a healthcare provider, we have to know what are the therapeutic techniques, what are the blocks of therapeutic techniques, and before to diagnose the patient, we always go for psychiatric assessment. In during the psychiatric assessment, we always follow the psychomotor movement, or we have to see my patient interest is decrease or increase. Decrease interest is very common psychiatric tools, or patient have any suicidal ideation or not, because suicide is a risk factor in psychiatry unit. Also, patient give the history of sleep decrease or sleep increase, too much sleep or no sleep at all. Also, the patient give a history to decrease the concentration, or patient give increase the appetite or decrease appetite, or some people give the history they feel guilty always, or some people give the history they decrease the energy, right? They're apathetic, they're broken, they cry all the time, they're very sad, symptom of depression. On the other hand, if patient is too much happy, look like too energetics, right? This is the sign of mania or manic. So it is always important, or it is important to keep it mind, the safety is the first priorities when we deal with the patient. Also, maybe in other lecture, I will explain what are the risks for the patient, right? So the client at the risks for even self-injuries. Also, patient give the history of family problems. They have a relationship issues, the feelings of stress during the work or in school, or also they sometimes react very badly react to the trauma or abuse, or poor body image, or difficulty associated with sexualities. Also, they feel self-esteem issues, feeling of rejection, feeling of guilty, or not to make a or sometimes feel the peer pressure. So this is the basic summary of mental health.